I've been working in the healthcare system for years. I ran a physical therapy company in Florida for 15 years before moving here. My favorite thing about that job was helping our social worker. So when I moved to Tennessee, I decided I'm going to go into social work. So that's what I did, and I've been working with the Health Assist program for 12 years now. We were taken over by Family and Children's Service. I'm very happy to be there. It's a great agency. Through the years, we've been through the start of redetermination under one governor, the doing away with 10-care standard for adults by another governor. And as I've worked through my job, I've seen more and more people become uninsured. And so we understand the need that's out there, and particularly for people with pre-existing conditions. And we've had too many people who have to choose between, getting treatment for something that is something that's treatable, and possibly losing their house and losing their life savings, and they're concerned about their spouse being left with nothing, or just saying, you know what, I'm not going to lose all these things. I'm just going to go without treatment. This diagnosis is now going to be a death sentence for me, but at least my wife has a roof over her head. And I can't tell you how many cases that we have like that. And it really, literally tears your heart out. And I am so thankful every week for the Tennessee Justice Center, because we collaborate on many cases, and they can help shine some daylight on some of these situations and publicize it. We can't always do that, but they've been so helpful in doing that with some of our cases. One of the things that John brought up is exactly true. We have 3 navigators. We have 6 other individuals who work in clinics enrolling people. We find that there are a lot of people out there who haven't had insurance for years, and they don't understand, oh my gosh, you mean you have to pay them every month, and then when you go to the doctor you might have a copay. This is all news to a lot of people, so we spend a lot of time just doing basic counseling of what insurance is, and that you have a monthly premium, and then sometimes you have a deductible and then a copay. And then you get into all of the plans that you have available, and it is so confusing. So what we generally do is we start with that prospect first. Let's talk about plans. We don't tell people how to pick a plan, what plan to pick. We give them information about networks. If they've been seeing a doctor, we want to make sure they can continue seeing that doctor if they enroll in insurance. So we want to make sure they get into the right network. We talk about what they can afford, and we narrow it down for them and then let them choose what they want. Thankfully, with some of the financial assistance that's available, there's something called cost share reduction. There's not just the premium tax credits that the federal government pays directly to your insurance company each month, so you only pay a reduced amount. But there's also cost share reduction, which may bring your plan down to where you have no deductible at all. So right away, the insurance company starts paying. And I can tell you, I've enrolled people who have gotten plans where they've got a $25 to maybe $50. I'm sure everyone's heard about the Cover TN plans that went away January 1st. Those plans were very limited in nature. They were about $60 a month is what people paid for them. But I think the cap was $25,000. So if they had to go for some type of, emergency surgery, and they racked up a $100,000 bill, then guess who was going to pay $75,000, or the hospital is going to end up writing it off. Now these same people can probably pay less for their premium, but get a full plan where there's no cap on it. So we have been able to see people who have been denied insurance, who couldn't get it before, who were paying more for a really bad plan, who can now pay less for a really good plan. And you don't hear those things. You hear a lot of misinformation. So that's the other part of our job, is to give accurate information. That's what, I'm the one who sent this flyer around. So if you have questions, if you know anyone who is without insurance, you can call our number, It's on there 724-1339. That's our Get Covered number specifically for the marketplace and signing up. If you're down in Williamson County, we're going to send you over to Mercy. We're going to send you somewhere local. We do have events all over Nashville. And we also still have the Health Assist program that I used to work in, where we help people who are falling through the cracks, the ones who can't get Medicaid. They're under the income to go to the marketplace, but they can't get Medicaid because they don't meet category requirements, and we didn't do the Medicaid expansion. So we would direct you to a clinic like Mercy. There are things in Davidson County. There's a program that used to be called Bridges to Care. It's now called Project Access. And you go to a clinic. If you need to see a specialist, they refer you to a specialist, and you pay maybe $20 for that. So it's a really good program. But our Health Assist program also helps with medications. So we have many ways to help you out, whether you're eligible for the marketplace or not. We will find a way to.
The clinic that I was running is actually in Texas, and when I finished that, finished my degree. So right now, I'm not in practice, but I can tell you a lot about what happened when I was running the clinic. And the clinic was in an area, and it was an African American mission that had been there since the 1950s. But the population of people who were seeking care, became more and more Spanish-speaking Latina women coming to the clinic. And so this is the group of women with the highest rate of being uninsured. And a lot of that is due to having jobs that don't offer health insurance. And so it is a big problem, and it's been a growing problem. But we will, there's a lot of good. I think I just saw 8 in 10 Latina women are eligible for, this is nationwide, not necessarily in Tennessee, because again, low-income women, unless they're also in a category that places them eligible for TennCare, wouldn't be eligible. But, nationwide, there are a good number of women that will be.
Sorry. You're asking what is the definition of those people who, quote, fall through the cracks in terms of their income and coverage? Is that correct? And Sandy, she's addressing it to you.
Okay, for the marketplace, you have to make at least 100% of the federal poverty level to be eligible. So you have to pay enough in taxes, to get the tax credits and all that. But the other side was they had expected that all the states were going to do Medicaid expansion, so it would be real easy. If you're under 100%, you would be on Medicaid. If you're over 100%, you make enough to go to the marketplace. Unfortunately, we didn't do that. If I brought something that I can pass around if it's helpful to you in your communities, and it's basically a screening tool, and it gives for household members all the way up to 8. What your household income needs to be for you to go to the marketplace. It needs to be that or over. And if it's under that amount, then if you meet a TennCare or Medicaid category requirement, then you can possibly get TennCare.